Good morning, everyone, and welcome. This is a very exciting day. I've been anxiously awaiting getting another COVID booster, so I'm very, very excited about this. In 1928, my mom and her two siblings made medical history. It was the first time that three siblings caught polio on the very same day. And many decades later, when the polio vaccine came out, all 8 of us kids lined up to get the polio vaccine. We were very, very, very excited about that. And now we're all very, very excited about getting this COVID booster. It's so very, very important. We're living at a time where people don't always believe facts. They're more focused on what their beliefs are. And so that's our challenge, is to relay these facts because it will save lives. There is a lot of information on the city's website about the COVID booster. And we believe in making it very, very easy. You just go to cityofchicago.org. It takes you right there, and it gives you all the information you need to line up and get that COVID vaccine. So I'm very, very excited about that. And I'm also very excited now to introduce our mayor, Mayor Lori Lightfoot.
Thank you, Joe. Good morning, everyone. And I also want to acknowledge the other people that are here with us who you'll be hearing from, Dr. Artie, Dr. Luna, Brandy Kanazi, and let me just say, Commissioner Kanazi of the Department of Family and Support Services has been burning the candle at all ends for the last 2 weeks because she and her team have really been taking the lead in making sure that the migrants that are coming to Chicago from Texas are well taken care of, that they have a place to stay, that they are getting medical triage, that they're getting legal services. So I just want to publicly thank Brandy and her team for really doing an incredible job. Let me also acknowledge my friend, Alderman Walter Burnett, and thank him for being here. You heard from Alderman Kappelman. We also have with us Joyce Chapman, who wears many hats, but today she's wearing her Phalanx Healthcare Services hat, one of our great partners on the far south side of Chicago, who's also going to be bringing a few words with regard to this new COVID update. We're here today to provide that update, that the new COVID vaccine will help us build on the tremendous progress that we've made over the course of this pandemic. Ever since vaccines arrived in our city back in December of 2020, they have been a necessary, important, essential, life-saving game changer. I can't think of enough adjectives to talk about how important the vaccines are, not only to slow and stop the spread of COVID-19, but also reduce the chances of severe illnesses if one contracts the virus. For that reason, the city and the Department of Public Health forge really important partnerships with local healthcare centers, community organizations, faith institutions, and many others to make sure that we were rapidly responding, providing free and equitable distribution of the vaccines. And now, over a year and a half later, COVID-19 vaccine is widely available all across our city. As of August 31st, over 70% of Chicago residents are fully vaccinated. That is great progress. But we know we can do better. And I know that there's more that we can do to protect ourselves against COVID-19's variants and subvariants. That's why I'm pleased to announce that starting today, CDPH is supporting the rollout of 2 updated COVID-19 vaccines designed specifically to target the Omicron subvariants, and we'll get into that a little more in a moment. This announcement is in alignment with the final recommendation of the CDC and the emergency use authorization from the FDA, and will help further protect the health and well-being of our residents. And these updated vaccines, called bivalent boosters, are a mix of 2 versions of the vaccine. This means that they both boost protection against the original COVID-19 strain, as well as now the predominant strain, BA4 and BA5 Omicron subvariants, which make up nearly all the new COVID-19 cases in the United States, and Chicago is no different. Importantly, these updated vaccines are only approved for those who have completed the primary series, which means that you have had to have had 2 doses of either Pfizer or Moderna, or 1 dose of J&J to get this new vaccine. They are also recommended to be administered at least 2 months following the completion of the primary series, or if you got one of the other boosters. And they will replace current booster dosages for those 12 years and older. The updated Pfizer will be available for 12 and up, and the updated Moderna will be available for those 18 and up. And you can pair either updated vaccine with your annual flu shot and some other vaccines, which we also recognize. As summer fades and the weather gets colder, more and more people not necessarily will be going indoors, which increases the chances of contracting COVID-19 and the flu. So make sure that you take advantage of this opportunity and get your COVID-19 shot, as well as flu vaccines, out of the way in one fell swoop. Updated vaccines are now available at more than 130 pharmacy locations in Chicago, and we recommend calling and visiting your local pharmacy's website for more information on availability. We also recognize that pharmacies are not available in all areas of our city, which is why CDPH will also be stepping up opportunities to get vaccines through its offerings. This includes clinics hosted by the department, where a $50 gift card may be offered for those doses depending on availability and eligibility. Updated vaccines will also be provided through the very popular CDPH at-home vaccination program called Protect Chicago at Home. So you don't have to, if you're nervous or can't get to a pharmacy or one of our clinics, we will bring the vaccine right to your home and vaccinate everybody in your household who's eligible. Additionally, CDPH will host family vaccination clinics at city colleges of Chicago through the month of November. And many people have taken advantage of these clinics that have been consistently running throughout. And continue partnering with aldermen and civic organizations, faith organizations across all 50 wards to provide flu and COVID vaccination clinics this fall. So to learn more and to register, please visit chicago.gov/Chicago COVID Vax. That's chicago.gov/COVID Vax. I strongly encourage those who are eligible to get their updated booster as soon as possible. I will be doing that for myself and my family. And if you're not vaccinated now, get your primary series started. You can receive the updated booster in 2 months' time. Folks, you think about where we were standing at this podium in March of 2020. We've come a long way. But there's more that we can all do to make sure that we are safe, that our households are safe, that our workplaces are safe, that our city is safe. And this newest vaccine, I think, provides another important opportunity to make sure that we're protected against the predominant variant here in our city of Omicron. So with that, I will bring up to the stage Dr. Allison Arwady. Dr. Arwady.
Thank you, Mayor. So it's been a while since we've done a COVID vaccine press conference, but we're doing a press conference because this is a big deal. This updated COVID-19 vaccine is the first time we've had a change to the kind of COVID vaccine you can get. Protection not only against the original strain of COVID, which is what we've been using for all of the vaccines and boosters to date, but now also new protection against Omicron, BA4 and BA5. It's fantastic timing. You're going to see 99.9% of all of the cases of COVID right now are this BA4, BA5 subvariant. So getting the vaccine that is a perfect match is your best chance to not only protect yourself and your family and your community long term against severe outcomes, but also hopefully to help us get ahead of the COVID virus looking to the winter. Here we go. We are still in medium as a county and as a city, and I expect that we will likely stay in medium, but if our numbers are going up again, we may come back into high shortly, and about 80% of the country has been at either a medium or a high level. Last week, as you heard, the FDA, the Advisory Committee on Immunization Practices, and the CDC all gave this updated vaccine the green light.
Maybe you could just hit the...
Could you go? Go ahead. A little bit of an issue, sorry.
Just hit the clicker.
All right, I'll just keep talking, no worries. When we get those going, it'll be fine. Most of Chicago is eligible for this updated vaccine. In fact, 77% of Chicagoans age 12 and up have had their primary series, which means 77% of Chicagoans right now can get this updated vaccine, and we want you to. There we go. All right, perfect. So that's about 1.8 million Chicagoans of age 12 plus. I want to just run through some frequently asked questions and underscore a few things that the mayor said. Who can get this updated COVID vaccine? Anyone over the age of 12 who has completed their primary vaccine series. Does it matter if you got a booster in the past? It does not. If you never got a booster, this is the one to get. If you got your updated booster all along and it's been 2 months, this is the one to get. When can you get that updated COVID vaccine? As long as it's been 2 months since your last COVID vaccine. Are there age limits? Pfizer is for those over age 12. Moderna is for those over 18. We may have an updated booster in the future for younger children, but at this time, they should just be up to date with all of the vaccines so far, and this updated vaccine is only for those over 12. Should I wait to receive the updated COVID vaccine if I recently had COVID? So some of you know, I recently had COVID in late August. I definitely had that BA.4/5, and you're not required to wait for a vaccine if you just had COVID, but the CDC says you can consider waiting up to 3 months from your most recent infection. Because I had my most recent COVID in late August, that means I will definitely get this vaccine before the end of November. And if we start to see the virus changing again, we start to see new variants coming, let me tell you, I'll get it sooner than that. Because right now, again, is the perfect match for this COVID vaccine and variant. How do I know the updated vaccine is safe? This updated vaccine uses the same technology as the prior Pfizer and Moderna vaccines, and those, of course, have been safely administered billions of times now around the world. There were human trials that were completed for an updated bivalent booster, the original plus Omicron BA.1 and BA.2. Those human trials were completed earlier this summer, and then they showed good antibody response, better protection, and no new safety concerns. The same side effects, primarily sore arms, sometimes short-term fever, that we've seen with the other boosters. And then that version, that human-tested version of the Omicron bivalent vaccine was then better matched to that spike protein of BA.4 and 5. This is the same way that flu vaccines get updated every year. We make them match the circulating flu strains. So please know that the research has been done. These vaccines are safe and available, and everybody over the age of 12 in my family will be getting one. Can I still get the original booster? Actually, no. For people over 12, this booster is replacing the old booster. So the one you're going to be getting from now on is the one that both gives you better protection against the original strain and the update. Individuals 5 to 11 can still get the original booster dose. And will it still be free? Yes, thankfully. The federal government is providing the vaccine, the ancillaries. You don't need government identification. You don't need insurance. This vaccine is free and available for everybody over 12. Why do we need an updated vaccine? So we know boosters have provided great protection against hospitalization and death for Chicagoans. You can go to our website and see Chicago data that shows, you see those two graphs there. The red are hospitalizations on the left and deaths on the right for unvaccinated Chicagoans. That big spike was last winter. The light blue are those who had gotten their original vaccines but not a booster, and that bottom blue are the booster. And so you can see that just since the Omicron variant has been dominant in Chicago, unvaccinated people more than 3 times as likely to be hospitalized as those who have been boosted, and about 6 times more likely to die than those who have been boosted. So the original vaccine helps, but boosters matter, and this is by far our best booster and our best updated vaccine. Why else do we need an updated vaccine? So as you heard, it's a mix of 2 versions of the vaccine, and more than 99% of the COVID cases right now are caused by those subvariants. So this gives us a chance to get ahead of the virus. If we can get a lot of people protected right now from the variant that's circulating, we'll see fewer transmissions and hopefully less emergence of new strains, which is what we really are concerned about heading into fall and winter. And finally, we need an updated vaccine because we're seeing a lot more people get reinfected. People who had COVID in the past getting COVID again. You can see on this graph here, that blue line shows the percent of COVID infections in Chicago that have been 2nd or 3rd or even 4th infections. And before Omicron, consistently about 2% of our cases were people getting infected for a second time, probably people who didn't have as strong of an immune response. But with Omicron, we saw that really shoot up. And with BA4 and 5, even if you had an earlier version of Omicron, if you had COVID in January or February, we're seeing people get infected again right now with BA4-5. So really critical to get that updated vaccine. If we look just at the last 6 weeks, 36% of our reinfections are people whose previous case was during Omicron. So if you think you're counting on, I've had COVID, I've had a prior vaccine, I don't really need this updated vaccine, please don't count on that. Getting this vaccine gets you the best protection we've had yet, and it will help protect you even if you had Omicron this year. This couldn't be better. 99.9% in green and blue here of our cases across the Midwest and in Chicago are this BA4-5, and it's the same thing in the US, 99.9%. Couldn't be a better match. We would love it if our flu vaccine were this good of a match. We just need people to make the decision to get up to date. So finally, will I be able to find an updated COVID vaccine? Yes, you will. We have been allocated about 150,000 doses in Chicago from the federal government just over this first week, with more following as we use supply. That's about 20 times the amount of vaccine we were able to get at the beginning of the rollout, and so there is no prioritization. We, of course, most need those over 65 to get vaccinated, but you are eligible and can get a vaccine this week, even if you are 12 or 13 or 14 years old, and we would love to see you do that. We've got 90 retail pharmacy locations that are receiving vaccine in the earliest shipments, and about 170 will have received vaccine in Chicago by the end of this week. So thanks to the team and all the partners. That's not just the CVS and the Walgreens. That includes your grocery pharmacies, smaller pharmacies. We know that most Chicagoans have gotten their vaccines through pharmacies, and so we put about half of the vaccine there. We've worked hard to make sure long-term care facilities are getting vaccine. Of course, those are our highest risk individuals. And then we've been working with hospitals and other providers that serve high risk individuals. We've got about 45 healthcare sites that will have vaccine in this first week, and then many more adding in weeks to come. And then, of course, our federally qualified health centers. Protect Chicago at Home. We are prioritizing at-home appointments for older Chicagoans, those who are homebound, and those in our least vaccinated zip codes. We're working with congregate settings and senior settings like Department of Family and Support Services senior centers. CPS is receiving vaccine vaccine through its provider, and then we will be having family vaccination clinics. We will have both updated COVID vaccine and this year's flu vaccine, and we are more than happy at any of these sites to start you on your COVID vaccine if you didn't get your original, and then we can bring you up to date. This Saturday, we will be hosting the first 2 large clinics at Olive Harvey College and Arturo Velasquez Westside Technical Institute, Saturday 9 to 2. You can sign up on chi.gov/COVIDvax. And then lots of equity-focused work, as the mayor said. Through our Healthy Chicago Equity Zones, we'll hear from Phalanx. Aldermanic sites, thanks to these and other aldermen, we will have at least 1 vaccine location in every ward. We're doing faith-based work. We're working with the Community Safety Coordination Center. Swaparama is going to continue. That's a very popular location on Sundays. We're going to have City Hall clinics, some other clinics for city employees. CDPH will be hosting some clinics. Our mobile caravan will be out. We have some focused CPD and CFD first responder clinics, and then working with Blue Cross Blue Shield for some Blue Door events. This is just to give you a sense. The blue dots are pharmacies, and you can see that pharmacies in Chicago are really quite concentrated in the Loop and in the North Side area. And so we've worked to fill in hundreds of other dots across the city, and you can go to our website to get a sense. But I want you to hear that no matter where you live in Chicago, there is vaccine available for you near your home, and we believe you can bring it to your home if it's some of the areas where there are not as many pharmacies. And so just finishing with that, with the updated vaccines, Protect Chicago at Home is, you can sign up through chicago.gov/at-home or give us a call at 312-746-4835. We are initially prioritizing updated vaccine appointments for free for anybody in the city who is over 65 or homebound, as well as anyone living in those eligible zip codes. And we continue to have gift cards, especially for people getting primary series anywhere in the city. We're happy to bring you at your home a first dose or a second dose, and then this is our prioritization for the updated vaccine. So you need a vaccine, you need a booster, you have any questions, our team is staffing this number 7 days a week. Please don't think, oh, this is just more COVID news, I'm really tired of COVID, I don't need to do anything. We need Chicago to get this updated vaccine. It's new, it's different, and it will give better protection than what we've had previously. And with that, I'll bring up Dr. Luna.
Thank you, Dr.
Muy buenos días a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago, y hoy les traigo las actualizaciones. Tenemos una muy buena noticia, y es que ahora tenemos disponibles las vacunas actualizadas contra el COVID-19 para proteger a las personas de la variante dominante del coronavirus que circula actualmente en los Estados Unidos. Y a medida que nos acercamos al otoño y al invierno, necesitamos esa protección. Esta vacuna se llama refuerzo bivalente, lo que significa que tiene 2 versiones de la vacuna que protegen inicialmente contra la cepa original del coronavirus y ahora esta nueva protección que tenemos contra las subvariantes B4 y B5 del Omicron, que son el 99.9% de todos los casos registrados en los Estados Unidos. Esta nueva vacuna está aprobada para administrarse en personas de 12 años o más con Pfizer o 18 años o más con Moderna, 2 meses después de quienes completaron su serie primaria o refuerzos con Pfizer, Moderna, Novavax o Johnson & Johnson. Y para aquellas personas que que tomaron su serie inicial con cualquier vacuna aprobada por la ONU o la Organización Mundial de la Salud, si viene del extranjero. Los pacientes pueden mezclar y combinar vacunas de la serie primaria de sus refuerzos. También pueden combinar la vacuna actualizada bivalente con su vacuna actual de la gripe o con cualquier vacuna que le quede pendiente, siendo 100% seguras. Esta vacuna actualizada reemplazará las dosis de refuerzos actuales para personas de 12 años de edad o más. Las vacunas actualizadas han cumplido con los estándares más rigurosos de seguridad, eficacia y calidad de fabricación que tiene el sello de aprobación de la Administración Federal de Drogas y Alimentos, o la FDA, y del Centro de Detección y Control de Enfermedades de la CDC. La vacuna estará disponible en Chicago esta semana. Sabemos que los adultos mayores y los pacientes inmunocomprometidos tienen más posibilidad de enfermarse gravemente por este COVID-19 en el momento. Por eso alentamos que sean estas personas que tomen la iniciativa y reciban la vacuna actualizada lo antes posible. Hay muchas maneras de que las personas pueden obtener las vacunas actualizadas. Pueden llamar al sitio web o a su farmacia local o pueden ir a nuestras clínicas del Departamento de Salud, que en un lente de equidad suple esas farmacias o esos lugares donde todavía las farmacias no tienen esa disponibilidad. Protege Chicago al Hogar también ofrecerá la vacuna de refuerzo del COVID-19 para personas con una priorización a las personas confinadas al hogar y a las personas mayores de 65 y los que viven en ciertos códigos postales con los niveles más bajos de vacunación, otra vez en un lente de equidad. Y todas las clínicas corridas por la ciudad están dando el incentivo de los $50 por vacunación, dependiendo la disponibilidad y la elegibilidad que usted tenga. El Departamento de Salud también tiene toda esa información disponible a través de citas al hogar o directamente en nuestras clínicas en chicago.gov/@home, o también puede conseguir las citas en Chicago o chai.gov/COVID-vax o llamando al 312-746-4835 si no tiene conectividad. Le hablamos en el idioma y la cultura que tú y yo entendemos. El Departamento de Salud extenderá ahora las clínicas de vacunación familiar en los City Colleges o los colegios de Chicago hasta noviembre, ofreciendo vacunas contra la gripe y contra el COVID-19 con Pfizer y Moderna para niños de 6 meses en adelante. El horario es de 9 a 2 de la tarde. Se recomienda registrarse, pero si no puede, las citas ambulatorias también son bien recibidas. Estas clínicas empezarán a dar la vacuna actualizada en Olive Harvey College y también la tenemos disponible ahora en Arturo Velázquez. Así que por favor, apersónense y lleguen y tomen su vacuna actualizada. El CDPH o el Departamento de Salud se está asociando con concejales que tenemos aquí presentes para incluir la vacuna actualizada del COVID-19 hiperlocalmente donde usted viva. Estas asociaciones incluyen clínicas del Departamento de Servicios Familiares y de Apoyo y otros que tengan entornos congregados para hacérselas llegar a las personas que más lo necesitan con el mínimo de accesibilidad, a menos que nosotros se la hagamos disponible. Vea el calendario completo y encuentre toda esta información en chicago.gov/Vax Calendar o chicago.gov/COVID-Vax para más información, para encontrar su vacuna. Así que gracias y cuídate, Chicago.
Thank you, Dr. Luna. Good morning. My name is Brandy Kanazi, and it is my honor and pleasure to lead the Chicago Department of Family and Support Services. Our department works to support some of the most vulnerable residents in Chicago, as well as the community-based organizations that serve them. We serve vulnerable and at-risk children, youth, survivors of gender and domestic violence, individuals experiencing homelessness, seniors, and more. All of these populations have faced serious challenges during the COVID-19 pandemic, and we worked with countless partners to ensure individuals had the resources they need to navigate such unprecedented times. These lessons learned from COVID were abundantly clear and real in terms of the impact it had on our seniors, medically, socially, and economically. We believe that our work is meant to support seniors as they age independently and safely within their communities. We offer services and resources that empower, engage, and enrich the lives of older adults. But with COVID came severe isolation, financial burdens, fear, and health concerns. And so when vaccinations were developed, it was the critical concern that we work with our partners at CDPH to protect our city seniors and help them get back to their pre-pandemic lives as quickly as possible. We worked in partnership with CDPH to connect seniors to vaccine opportunities, provide educational awareness, and help address vaccine hesitancy. September is National Senior Centers Month, and the theme is strengthening community connections. We are kicking off our month-long celebration by welcoming health partners into our senior centers to provide vaccination support in the same community spaces that provides fitness, recreation, meals, and health, wellness, and supports. In keeping with that partnership, from today, September 6th, through September 16th, from 9:30 a.m. to 12:30 p.m., all of our 21 senior centers will offer flu and pneumonia vaccinations, as well as the original series and the new booster shot. Additionally, we invite our frequent senior center visitors and those who are visiting for the very first time to participate in our programming. We also want them to stay and enjoy a meal, as well as the many resources and activities that we offer. Our seniors are open and available to all older adults, age 60 and better, as well as those who reside in Chicago. You all have a standing invitation to come and check us out. To find your local senior center and find the next vaccination event, please visit chicago.gov/seniors. Today is an important step forward for our community's older adults, and as we continue to protect our communities from future waves of the COVID-19 virus. Thank you again, and now I would like to bring up our partner, Joyce Chatham from Phalanx Family Services. Thank you.
I got to check and see if it's still morning. Good morning, everyone. My name is Joyce Chapman. Thank you, Mayor Lightfoot. Thank you, Commissioner Waddy. You are just we at Phalanx talk about you so much, the intelligence in which you give us all the time. We thank you. And to the Alderman, Commissioner Kanazi, and Dr. Luna, thank you for this opportunity to speak to you from, we say, from the boots on the ground. We are that Phalanx Family Services, located at 837 West 119th Street. Over 15 months ago, we were asked, well, our CEO, Tina Sanders, and our Director of Operation, Laura Bailey, was asked to partner with CDPH. Then they tugged me along and said, Joyce. I said, what? They said, Joyce. And we came to the meeting, Dr. Owadi, and from there we became the Far South region for Healthy Chicago Equity Zone for the city of Chicago, and what is such a great pleasure to serve. We have 11 community organizations that work with us, from Hegwish to South Deering to East Side to Calumet Heights, West Pullman, the greater Riverdale community, what back in the day they called out there on 130th Street. We have they're going to kill me if I do not mention them. Washington Heights and Morgan Park and Roseland. But at the end of the day, everyone, we are there to provide the services, to host events. Dr. Wadi mentioned about incentivize our people. We have a $50 gift card for the first, second, and or booster. Now, since the new booster came out, and I'm 66 years old, they could come to my house, Dr. Wadi, and they can incentivize me, because I never got an incentivized card. But it's very important. I'm not making light of any of this, but it's very important that everyone take a, as Laura Bailey tells me all the time, Joyce, sometimes you might have to pause, pivot, and turn. And that's what we're doing with the new booster. Pause, pivot, and turn. So our community leaders are out in the community every weekend, every day, dropping literature, letting people know about the new information that's out here. So please, City of Chicago, we are 6 regions, but we serve the mighty, mighty city of Chicago. So please, take heed about this information about this new variant, this new boosters that's this new vaccine that's coming out. It is out, and we're ready for it. So come visit us at 837 West 119th Street. Although our number's not up there, but you could contact us at 773-291-1086. I thank you so much.
Before I take your questions, I want to take personal point of privilege and say happy birthday to my mother, 94 years young today.
All right, happy birthday.
Happy to take your questions.
Thanks, Mayor. And members of the media island, I will come down and give you the mic. 2 questions per reporters. We'll start with On Topic with Sean Lewis from WGN.
Good morning, Mayor.
Good morning.
Let's talk about how this is going to be rolled out, because I think a lot of people have questions on if they will go make their appointment this week, if they're going to be getting the old version of the booster, the new version of the booster. How confident are we that they'll be getting that newer version if that's what they want?
No. If you have already completed your first series, meaning you got Pfizer, Moderna, or J&J, and you got the completion, 1 shot with J&J, 2 shots with either Pfizer or Moderna, you are eligible if you're 12 years old or up. So obviously, all of the clinicians that are going to be administering the shots know exactly. They'll ask those questions. Obviously, people should be bringing their booster cards, and then they'll know exactly what to do. And unlike last time, it's open to anybody who's 12 years and older. There's no tiering, there's no prioritization. We just want people to get this new booster. We're going to be placing clearly great emphasis on those that are 65 or older, those with underlying conditions. But this is open and available at pharmacies and clinics all over the city, and we're ready to go.
The positivity updates, I know we're doing a lot with the storm sewer, or rather the wastewater sewage, as opposed to testing, because a lot of people are not reporting their at-home
Right.
tests. How is that going, and what is it showing right now?
I'll ask Dr. Ari to come up and answer that question.
Sure. So yes, we continue to both test samples from all over the city, which is how we know that more than 99% of our clinical cases are BA4-5. And, excuse me, we've been doing wastewater surveillance. So we both sample from the 3 large plants that kind of serve the whole city, and then we have 10 areas across Chicago that do a more focused sampling. And every week we update that on our website. We are continuing to see COVID really, we consider at a high level when we look at our wastewater right now, and that is true really across the city. There have been some parts of the city that sometimes surge and come down, but it has been another way for us to follow along, and I want folks to know that COVID is very much still here, even though you're hearing about it less. We see it in the wastewater, but this particular vaccine is a perfect match, again, for what we're seeing in the wastewater, for what we're seeing in clinical samples. And so right now is the time that we need people to step up and get that updated vaccine.
Amy Jacobson.
Good morning, Mayor,
morning.
and happy birthday to your mother.
Oh, thank you.
So the vaccine mandate that's in place for Chicago firefighters and police officers, how does this booster fit in with that?
It doesn't change anything. Our policy is still the same. Obviously, we're about, I think, 89% of our city employees who are vaccinated. So we just encourage those who have already gotten and completed their series to complete their series, to get this latest booster.
Okay, a real quick follow-up to that. Are you keeping the vaccine mandate in place for firefighters, police, CP, Chicago Public Schools?
We are
teachers?
not changing our pre-existing policy. You can ask one more.
Okay. So over the weekend, when the second busload of people came here from Texas, you said instead of having to guess who's coming, who's not, how many, and what are their needs, that's what mayors along bordering states and the governor of Texas have to deal with on a daily basis. So why not call on the federal government, President Biden, to try and work on border security?
Well, look, I think that we all need to collaborate at every level of government. But the difference here is, yes, you don't know when you're in a border city, a border state, exactly who's coming and when, although I think the intelligence on that has improved. But this is entirely within the knowledge of the Texas governor, who he's putting on buses, when they're coming, what their specific conditions and needs are. So the same thing he's saying, hey, I need more help, well, so do we. He's treating these human beings like freight, and like we don't need to know exactly what's what so that we can make sure that we have proper accommodations for them. All this is about is a manufactured political crisis. It doesn't need to be this way. If he really wanted to show leadership, leadership would be saying, regardless, I'm going to stand up and I'm going to do X, Y, and Z, and I'm going to then cooperate with the cities and towns and states that I am sending people to. there could be a lot of collaboration that works to the benefit of these poor souls that in many instances have been on the road for months seeking refuge from violence, from lack of economic opportunity, from starvation, all the vestiges of poverty and violence that we see, unfortunately, happening in home countries. We all should be on the same page, helping to support human beings who are in search of the same things that we enjoy as Americans, which is safety and freedom and the ability to just live our lives. But instead, what he decides to do is just spring it on us, put a bunch of people on a bus, and not care about the consequences. I cannot in good conscience, as a mayor, as a human being, as a person of faith, not care about what happens with these folks. So better collaboration, better communication would go a long way in making sure that we're all reaching the same objective that we should be, which is making sure that these people who have a right to seek asylum in the United States are provided with safety and security when they get here.
Sarah Schulte, ABC.
Back to the vaccine. Dr. Arwady might want to answer this, I'm not sure. But of the 77% of the Chicagoans who are eligible for the vaccine, what percentage of those do you think needs to get this new booster to avoid a surge in the fall and winter?
I don't have a crystal ball, of course. I would love to see 100% of the people get this vaccine who are eligible for it. We know realistically that's unlikely to happen. I continue to have the most concern about neighborhoods and social networks that are less vaccinated at baseline, which is why you hear us talking not just about the updated COVID vaccine, but saying, you know, if you are someone who didn't get a vaccine before, now is also a great time to start, even that original series. I do think it is likely that we are going to see some COVID surge this fall and winter. We would be very lucky to avoid that, but if you look both of the past 2 years, we have seen that surge. The big question for me is that surge Omicron BA.4 or 5, which we can be very, very protected against now with this new updated vaccine, or will we see the emergence of a new variant? And I don't know for sure. So I think we're in a very good place unless we continue to see very rapid emergence of variants. And so getting vaccinated right now with this updated vaccine is not just about me and my protection, it's about making it harder for new variants to emerge. And so the reason we're emphasizing this so much is that we can't completely control what happens in flu in the winter season. I do think we'll see probably some issues with COVID, but the more people who can get protected right now against the strain that's here right now will, I believe, help limit that surge.
Allison, if I can, I want you to do two things. Explain to people about how the variants spread and why a host who's unvaccinated is a perfect place for the variant to spread. And if I can we go back to the slide that showed what happened in the city during the Omicron initial surge in December and January?
Almost, yeah. There it is. Yeah, and this, we update this every single week on the website. So, first of all, viruses mutate. This is what they do. They evolve like any other living organism their goal is to mutate and change and live on. And the way they mutate and change is every single time COVID is spread from one person to another, there's copies made of the virus, and those copies get mutations in them. Most of the time, those mutations are not dangerous, but the problem is that when you get a mutation that in some way makes the virus stronger, makes the virus more contagious, makes the virus more likely to make people sick, that version outcompetes all of the other versions of the virus. And so what we see is the more transmission that is happening, the more chances there are for the virus to mutate, and when the virus mutates, that is when we see the emergence of new variants. And so when you've got folks who are not vaccinated or not protected, have not seen versions of COVID before, when they see a new version of COVID, it's an opportunity, it's a great opportunity for the virus to mutate and create a new variant. And so you getting vaccinated, like I said, it is for you and for your family, but it also at the population level helps us give less opportunities for that virus to mutate. And yeah, the mayor just wanted me to highlight this again. This is Chicago data, and it shows going all the way back since we've had vaccine. The red line is what has happened, hospitalizations on the left and deaths on the right, to unvaccinated Chicagoans. And so you can see that big spike was Omicron in this last January, but you can see even the spikes coming before that were largely falling on the unvaccinated in the red lines there. And then the dark blue line are those who have been up to date. And we were emphasizing this difference. If you look in January in that peak there, you see there's a big difference between the light blue line, which are people who also got boosted, the dark blue line, people who also got boosted, and the light blue, those who had gotten their original vaccine but had not been boosted. We know boosters are important. We know boosters are even more important when folks are older and have underlying conditions. And I want to see, to your question about what happens with potential surges to come, I would love to see it look like that dark blue line, right? And the red line are folks who are unvaccinated. The light blue are people who got the first vaccine. The dark blue is what we saw in prior surges when folks were boosted. And so let's look like a dark blue line here in Chicago, see very few hospitalizations and deaths, no matter what might come this winter.
If I can just put a finer point on this, we lost a lot of Chicagoans who died needlessly, in my view, because they weren't vaccinated. So this gives us, I think, another opportunity to emphasize to folks, COVID's still here. People are still dying every single day of COVID in Chicago and across the country. This gives us another opportunity to remind folks, this is not the flu. It is much more serious, it's much more contagious, and unfortunately, it's much more deadly. So we've got to get people vaccinated.
I actually asked Dr. Arwady this last Thursday, but let me ask you this.
Okay.
I mean, how worried are you that people aren't going to get this shot? I mean, booster rates are still incredibly low. Even the primary series is low among African-American men. I mean,
Well,
what is, and I know you've laid everything out here, but how worried are people? I just talked to some people last week, man on the street, I know very unscientific, but there were people that said, you know what, I did the 3 shots, I'm done.
Look, I get that there's COVID fatigue. There was COVID fatigue in 2020 and 2021, but COVID's still here, it's still contagious, it's still deadly. And I think we've got to continue to do everything that we can as a city government with our partners in the neighborhoods, the healthcare centers like Phalanx, like the other Healthy Chicago equity leads, to bring home the message that you are doing yourself, your family, and as Dr. Arwady said, our entire city a favor, because COVID spreads so rapidly. We've got to make sure that we continue to be diligent in getting people vaccinated. This booster is specifically tied to the Omicron variant that is the predominant, as you saw from the charts. So it makes sense to get this. As I said, I'm going to get it as soon as I can, and I'm encouraging others who are eligible to get this booster as soon as you can and be protected against the predominant variant that has been here in Chicago now for some months.
Craig, ABC.
There you go.
Sneaking up on me. I must say that I did like the comment about 60 or better from earlier. I believe that was I like the reference there. Mayor, I wanted to ask you, first of all, if we get your reaction to Sue Garza announcing that she's not going to run for a second term. And just in the bigger context, too, we've got about a quarter of the council that's going to be turning over for one reason or another.
I think more to come.
And more to come. This is going to maybe make the next council a little more independent. Do you agree with that assessment? And how might it impact the second term?
I can't look into the crystal ball and tell you who the new members are that are going to be coming to replace. That's what the voters are going to decide through the elections. But look, let me talk about Sue Garza first, and then I'll pan back and talk about the larger issue. What I understand is that Sue sat down, like many of us do, with our families, and made a decision that was in the best interest of her and her family. She has given the full measure of her being to her ward, to her community, and to the city of Chicago for 31 years. That is a really long time. And she's made a decision that I told her I was proud of, because she sat down and made an assessment about what her priorities were with her family, and they made this decision as a family. And we have to respect that. We also have to respect the work that she's done as a teacher, as somebody who opened up her house literally to the kids of the neighborhood, the kids of her school. You know, if you know anything about Sue Garza, she gives everything 1,000%. And she's made an assessment that now she's going to give her family 1,000% and not share herself with others. And you've got to applaud that. And look, I think, you know, there's been a lot written about the Great Resignation. Aldermen are not indifferent to that. And it's been very difficult over these last couple of years in particular to be a public servant and to be on the front line. They have a job that is very different than anyone else, different than a mayor for sure. And I think a number who have served, and there are some who are dancing a little bit of a jig earlier. I won't speak for him, but he can speak for himself. Have just decided, I want to move on and do something different. And many of them, I think, are going to be the things that have been really the things that they've loved, invest in community, focus on a particular issue. I think you're going to see many of them focus on those things. I think others are just going to say, you know what, I'm going to enjoy my retirement, like some have. So the Great Resignation didn't pass us by. I think people are making decisions about, again, what's in the best interest for them and their family, and particularly if they've been at it for decades, as many have. So, as I said, I expect to see more announcements in the coming days and weeks, and you've got to respect when people make that assessment. You know, a year ago, in an interview, I said running for re-election for me wasn't a gimme, and people lost their minds. But it's not a gimme. When you're on the front line and you are giving a full measure every single day, and particularly in the environment that we're in, this is a tough environment to be an incumbent, to be a public servant, and many people are making the decision that it's time for them to move on and do something else.
You'll probably be the first to admit that there has been some contentious moments that you've had with members of the City Council, whether it's Jeanette Taylor or others. Should you win another term with a different council, will you take any kind of different approach to governing? And will it be a kinder, gentler Mayor Lightfoot if there's a second term?
I think you overstate the reaction. And you bring up Jeanette Taylor. I have a perfectly good and productive relationship with her. We just saw each other over the course of the weekend. Look, I'm 60 years old. I'm not going to change who I am. And I definitely will have and will continue to push people sometimes out of their comfort zone, because that's what our residents are demanding of us. The status quo that I inherited is, it didn't work for people. It failed most of our residents. And it's challenging when you have somebody sitting on the 5th floor saying, we need to do better. We need to make sure that we're more responsive to our residents. But I think most of the members of City Council understand it, and we've been able to govern together. I don't govern by fiat. I govern with my colleagues in the City Council, and we've done tremendous things over the 3+ years that I've been mayor to benefit our residents. We're here today talking about COVID. We work together to make sure that we were meeting residents' need, both in communicating what the aldermen were seeing in their residents, what the needs were, but also to make sure that we were passing legislation that worked for people, whether it was putting dollars into the hands of small business people so their employees could stay employed, whether it's making sure that we had the right resources in public health and the Department of Family and Support Services. The list is on, making sure that employers were respecting time off for getting vaccinated, or if they had COVID, making sure that they weren't retaliated against, or as, for example, when the hospitality industry started opening back up, making sure that those workers had first dibs on getting their jobs back. There are a number of things that we have done to help the residents of our city every single day by working together. And we can't get that done unless we have a relationship, unless we are sitting down at the table. We're not going to agree on every issue, but we don't have to. It's a democracy. We debate, and then we compromise. And that is, frankly, I think the beauty of our democratic system is that we bring people from different walks of life, different experiences, but bottom line is our focus has to be on what is in the best interest of our residents. And I'm proud of the work that we've done now in 3.5 years. And we'll keep making that case to the voters.
Thanks, Mayor. AD Quigg, Tribune.
Alderman Burnett, anything you want to tell us today?
Not me. I'm running for re-election.
Okay, good to know. We'll note that. Mayor Lightfoot, have you or anyone in your office spoken with Governor Abbott or anyone in his office since this started in an attempt to coordinate? And have there been any talks with federal officials about what's been going on?
I'll take the second part of your question. Yeah, we talk with our federal partners on a regular basis, individually, through briefings, and not only our federal legislative partners, but we have been talking to folks at the White House, and I'm going to Washington later this week and going to be sitting down with some of the folks to describe for them what the conditions are on the ground here in Chicago, but also make sure that federal help is coming, not just to Chicago, but in all the cities and states that are welcoming cities and states, to make sure that we've got the resources that we need. But I think the level of understanding and collaboration is quite good. I'd love to have a conversation with Governor Abbott. I'd have a long list of things on my agenda, but I've been speaking, obviously, to him publicly about let's just treat each other with respect. Let's treat the people who are traveling across our country with respect, and look for an opportunity to have more dialogue. I won't say more, have some dialogue, some collaboration. We're obviously talking to people on the ground in Texas on a regular basis, but this is not a governor who wants to collaborate and cooperate with us. There's a way to do it. It's real simple. Pick up the phone, send me an email, work through third parties. I'd love to see that, because that to me would show that importantly, that he's regarding these folks as human beings who are deserving of respect and dignity, and not treating them just like freight to be shipped across the country.
Ted Phillips is preparing to step down from the Bears. The team is having a community meeting this week on the Arlington Park plans. How, if at all, does this change the dynamic of your talks with the team?
I don't think it changes it at all. As I said months ago, we were going to make a very compelling case for them to stay in the city of Chicago, and I think that we've done that. And we're going to continue our discussions. We're going to continue our discussions excuse me, with the league. But as you know, I'm somebody who likes to plan. So we've got Plan B, Plan C, and others in the works as well if the Bears decide that they're going to abandon the city of Chicago. I hope they don't, and we're going to keep fighting that fight as long as we possibly can.
Heather, WTTW.
Hi, Mayor. A WTTW news analysis found that the expanded and extended curfew the City Council approved at your request was enforced only 4 times between mid-May and mid-August. Does that data lead you to conclude that that was an ineffective attempt to fight crime in Chicago?
No, I mean, as I understand what you just said, it sounds like you're judging quote-unquote success by the number of people who were either arrested or given some kind of administrative notice. I don't view it that way, because as I said at the very beginning, this is not about being punitive at all. What I think we have to accomplish, and I think we're making and seeing strides in that direction, is number one, reminding parents that there is a curfew. When we were initially talking about this, a lot of parents didn't even know that there was a curfew. Number two is making sure that the young people themselves know that there's a curfew. And the bigger issue is making sure that we shut down as many of these big, huge gatherings where young people were traveling aimlessly across the city and not respecting themselves, others, or property. And I think we've seen a significant diminution in a number of those incidents since we did a full-throated public engagement campaign and changed the curfew. And remember, what we did is we made the weekend hours the same as the weekday hours. So that small gesture, I think, and that small change, I think, really benefited us. And look, and the other thing that I hope you talk to some police officers about this, excuse me, the vast majority of kids that are out after curfew, and policemen see them, they say, hey, it's curfew, you need to get on home. And the young people say, okay, I'm on my way. That's what should happen. I don't want to put kids in handcuffs and arrest them. That's not the point. The point is to make sure that their parents knew, that the parents are taking responsibility and educating their young people, that they know where they are and who they're with, and that we reduce the incidences of young people in large masses causing challenges all across our city, to our neighborhoods, to our small business people, and frankly, to themselves. And I think we've done a lot of good in that regard.
On another topic, Brandon Johnson today took the first step toward running for mayor.
I'm sorry, say it again.
Brandon Johnson took the first step for running for mayor, challenging you. Your reaction?
None. I'm doing my day job. There are going to be people that come, people go, people make announcements. I'm not focused on that. What I'm focused on is making sure that I do what the voters elected me to do every single day, that I deliver on the mandate that I was given, and that we educate people over the course of time about the things that we have done to benefit them. We're talking about COVID today, but we could talk about the amount of resources that we put into mental health, 10 times the amount of resources that were dedicated to mental health from the time that when I started. We can talk about, frankly, the progress that we've made in public safety, and I'm proud of that work. We could talk about the work that we've done around affordable housing, making sure that people aren't living in stable housing situations, what we've done through the pandemic to help with rent relief, what we've done on economic development, and how our city is probably the best positioned in the country as we recover from the pandemic and walk towards prosperity. There's a lot to talk about, so I'm focused on those issues and not who may be taking another step to get into the race. And my last thing I'll say is this. It's real easy from the sidelines to be critical, to say that things aren't working right. I think what Chicagoans want is a vision for the future that shows the brightness on the horizon, not creating some dystopian view of our city that is inconsistent with the reality that people face every single day. Do we have challenges? Of course we do. Are we working on those every single day, every week? Yes, of course we are. But there's a lot of good things that are happening in our city, and I'm going to remind people of that as well.
Thanks a lot, Mayor. Thank you, everyone. That's a wrap.
Thank you.